Hello friends, welcome to my channel. This is Arup Ghosh, clinical hypnotherapist and also a mind coach, mind trainer. So today we are going to talk about a very serious issue that we are getting as a therapist nowadays. And it is becoming a concern for every therapist today. Is that marijuana? Today we will talk about some information regarding marijuana. See, there is a term going on in the market known as medical marijuana. So, what is this medical marijuana all about? Let us talk. Let me give you some thing to think about. Let me share the basics of medical marijuana. Now, see, what is medical marijuana? Medical marijuana is the marijuana which is prescribed by medical professionals. Now, fine, that we understand. But why marijuana is prescribed? And to whom? See, first of all, let's come to whom it is prescribed. Why, where marijuana is indicated medically. Now, we have to understand that the indication of marijuana contains two things. One is cannabis, the whole plant, and another thing is medically, laboratory wise derived high refined derivatives of cannabis known as cannabinoids. These are the two things that we have to understand. One, cannabis, the whole plant, the plant extract, that is leaves, dry leaves, and another thing is the laboratory preparation within the test tubes, synthetic cannabis, that is known as cannabinoid. Are we together? So this cannabinoid, they are mainly composed of the THC or the tetrahydrocannabinol and cannabidiol. So this cannabidiol and that is CBD and tetrahydrocannabinol THC, these two molecules, these two chemical compounds are being processed in the laboratory clinically and made a substance, a chemical that is being injected by the doctors, and where it is indicated. So we have to understand why this cannabidiol and tetrahydrocannabinol are indicated where. We generally see that the doctors prescribe this medical marijuana in cases of extreme nausea and vomiting associated with the chemotherapy treatment in the extreme ends of cancer, metastasized to whole body. So this metastatic cancer patients, they undergo chemotherapy treatment, and with this chemotherapy there comes pain and nausea and vomiting, and it is refractive many a times to a lot of medicines, normal based medicines. Either they are responsive to high doses of opioid medicines, that is not opiate, not opium, but opioid, chemically derived from opium. And now they are experimenting on cannabis, that is cannabinoid, because it is much more easier and cost effective than opioids, and nobody has to monitor it. So where is this medical marijuana indicated? It is indicated in patients who are terminally ill, who are in no way going to live, whose life expectancies are very short. Those patients, the terminally ill patients, are given prescribed medical marijuana, or patients who are having chronic pain refractive to all pain medicines except narcotics. And this is the reason why FDA has not approved cannabis. It has only approved two cannabinoids. One is Dronabinol and the another one is the Nabilone. So this Dronabinol and Nabilone are the two chemicals which are only medically prescribed cannabinoids approved by FDA for the treatment of patients who are undergoing chemotherapy, having very green future, suffering with excessive extremes of nausea and vomiting, and patients suffering with extremes of pain, unbearable pain, which are not being treated, which are not responding to any other normal anti-pain medicines, analgesics. That is. There it is recommended by FDA. Now, why cannabinoids are recommended? Alright. First of all, you have to understand that FDA has classified cannabis and all cannabinoids as Schedule 1 controlled substance. That is the substance we all know, the usual dangerous drugs like morphine, heroin, cocaine, hydromorphone, opium, etc. And these all drugs are scheduled as Schedule 1 controlled substance. And in this Schedule 1 controlled substance, cannabis is there. You're getting it? Are we together? So cannabis is a Schedule 1 controlled substance, only indicated for patients who are having terminally ill disease or incurable disease. It doesn't cure anything. It just numbs the sensation of the nerves that make you nauseate, that make you vomit. It just numbs it down, and that is how a narcotic works. The pain, the nerve is going through the pain to your brain, and it numbs it down. So you do not feel pain, but it doesn't mean that pain is not there. It doesn't mean that chemotherapy is not causing you any effects. It is only muted by a narcotic pain medicine, either opium or opiate based medicines, or cannabis, cannabis based medicine. Are we together? So this is being misinterpreted nowadays, and we are coming across a lot of young boys and girls who are getting slowly addicted to this marijuana, because there is a team working for it, for the sales of this illicit substance. In America, medical marijuana is only and only indicated, as I said, for terminally ill patients. It is not for everyone that doctor prescribes. Doctor doesn't prescribe morphine for everyone, right? That's it. They do not prescribe it for everyone. It is only and only if indicated. Now, why it is indicated, or why the doctor prescribes? Because cannabinoids are cheaper than opioids, and there are risks with overdose with opioids, which cannabinoids have less, cannabis has less risk of overdose, but it does happen anyway, but the risk is low. So no supervision is required for cannabis, and that is another problem that takes you to, you know, dependence. Patient self administers when and wherever they want, and that creates a dependence, and it's a, you know, downward spiral. You go down, you go down, you go down, you go down, you go down. With each and every puff, you feel resistive and you feel less effect, and you go for a more puff, a more puff, a more puff, a more puff. And that is how you go down. So, another most important thing that you will be agreeing with me, is that the tax collection system. Now, marijuana, medical marijuana, what is happening? A patient is going to the doctor, and the doctor is diagnosing him or her with terminally ill disease, or say suppose refractive pain conditions like chronic arthritis, needing to go undergo big surgeries, and that person do not have any money, or any the physical conditions are not permitting of a big surgery. In that case, this person is not able to afford opioids because they are charged higher. So what they do, they go for the doctor and ask them if they are indicated or not for cannabinoid, for medical marijuana. And if the doctor thinks that yes, it is indicated, then the doctor prescribes. And after that prescription, they have to go to the government offices, and they have to make a card, a license. And it charges huge amount of money for making that medical marijuana license. For example, in Pennsylvania, it charges about $50 per year. Once it is expired, you cannot possess marijuana. So in Pennsylvania, it is around $50 a year, and every state has its own charges. Now they levy 10 to 37% tax on medical marijuana. 10 to 37% tax, and this amounts to huge number of patients having medical marijuana, and the revenue generated from them, and this revenue is being used for social security, food, shelter, hospitals, and a lot of things that the society gets from the government over this. In fact, a beggar also gets his monthly allowances. They also gets their food and their um, money from government. It is known as social disability, social security, and that is going on there. And this money, this extra fund, is coming from this type of tax collection. So we have to understand this, that for some people who are terminally ill, they are going to die anyway. They are having medical marijuana. They are being prescribed medical marijuana to have a better, relatively comfortable, you know, get it? A relatively comfortable, a palliative care, better way to, you know. So another thing, there is nothing medical about medical marijuana. Alright. There is nothing medical. It is the same thing, just tagged as medical because it is having a license with it that you have to buy from the government. It's nothing medical with it. Nothing. Nothing absolutely. It is a narcotic. It is a pain reliever. And that all narcotics are being used, being invented for that reason only. Like heroin has been invented as a pain medicine. Then we found out that, oh, this causes terrific amount of damage, terrific amount of dependence. So we banned it. It's again a pain medicine, a narcotic. And that is same with medical marijuana. It is not good for you. and not indicated also unless you are terminally ill or having a chronic problem like chronic kidney failure, chronic arthritis of the joints where you cannot walk, you are crippled. You getting it? So that is why medical marijuana is indicated. That is where it is indicated. So it is not medical in any way. It is having all the risk factors of smoking. It is having every bad chemical in it that a cigarette smoke does have. It contains the carcinogens that causes cancer. Believe me, search it out. It contains the carcinogens that causes cancers like nitrosamine, like reactive aldehydes, like polycyclic hydrocarbons, like the benzopyrene. Everything is there inside that medical marijuana. Are you getting it? It is not medical in any sense, except from a legal perspective of it, and indicated for those terminally very sick people that are going to die and have no choice, no other alternatives available to them. And always remember that there is insufficient data, as this is an experimental basis. Every medicine that comes in the market, every chemical compound that comes into the market, it is first for experiment, but because we do not have data. So medical marijuana also has insufficient data to draw strong conclusion about the safety of the medical marijuana. So we cannot draw conclusion about the safety of medical marijuana. The adverse effects are the same that all narcotics, most of them, has. They are tiredness, dizziness, increased appetite, cardiovascular effects like myocardial infarction, stroke, sudden death, cardiomyopathy. These are there because you are smoking in all the chemical compounds, not just THC or CBD. Then there comes short-term memory lapse. Recent events cannot be remembered. Then there are severe complications of schizophrenia and psychosis. And once that sets in, you are in deep trouble, boss. I tell you. It creates hallucinations, altered judgment. It is a spiral. It leads you nowhere. It's ultimately a scheduled 1 classified drug. Same with heroin, same with brown sugar, same with hydromorphone, same with cocaine, same with whatever you call opium. Everything is same. It is a schedule 1 classified drug. And that is the reason it has been banned in India. Then this paranoia comes, hallucination comes, and sometimes it is, very temporary, but sometimes it is a long term. Like smoking cigarette doesn't directly cause cancer, but all the patients who are having lung cancer or any type of cancers, and most of them are related to smoking. Same way, smoking marijuana won't cause you schizophrenia or psychosis, but most of the psychotic patient, you will have some connection with marijuana. And this is fact. I'm telling you according to my experience. So Medical marijuana indication is totally different. It doesn't cure cancer, it doesn't cure pain. It is a narcotic, and narcotic will do its work. It will numb your nerves and you will not feel any pain. But for that, you have to be terminally ill. So the main reason that is why I'm doing this video is just to let the awareness spread about this medical marijuana, which is, is getting rumored, it is getting, fabricated, it is getting commercialized. Okay, I'm getting clients as young as 17 years. They are highly addicted to marijuana. 17 years, they are in class 11, class 12. Who are supplying these things to them? Where they are buying from? And every person is coming to me and telling me this is medical, this is very good for health, this is, in America they are prescribing this, they are prescribing that. And oh my God, what has happened? They're all brainwashed. And this needs to be stopped. I feel, as I am also a father, I feel from, very, 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 very agitated when these things comes to me. They are not knowing what they are doing. If a matured person is having, okay, I can understand. But if a 17-year-old or 18-year-old or just 16-year-old boy, girl, little boy or girl who are now making their careers, they are getting this marijuana addiction in their schools, and I'm not talking about one or two cases. This has been a trend now. There is nothing medical about medical marijuana, please understand. It is a narcotic, and it is an experiment. Like, for example, when the rofecoxib medicine was launched, it was claimed that it is 800 times more safer than aspirin, as aspirin causes gastrointestinal bleed and rofecoxib is a molecule which is 800 times safer and it will never cause gastric bleeding. And that's true. Doctors were happy absolutely because this is a new molecule. Doctors were writing rofecoxib like anything because it was so effective in controlling pain and being proved that it is safer 800 times than aspirin. But what happened? This rofecoxib banned. This rofecoxib molecule caused a severe fatal long-term effect, killing innumerable number of people. And the international brand of this rofecoxib molecule has been pulled out of market overnight. And they gave compensation to each and every person that was suffering with this unfortunate end. Because we never know what the future will come and what and how a molecule is going to react or act within the person, within the system, within a body system. We do not know. We do not have enough data. And this is an experiment. Please. This is an experiment to use cannabinoids in terminally or chronically ill patients. Now, when I call the term cannabinoid, it means artificial cannabis, synthetic laboratory made cannabis, not the rolling and all that, the real stuff that you get on the market. No, it is not that. It is highly refined Dronabinol and Nabilone. Nabilone and Dronabinol are highly refined, chemically made synthetic cannabinoids. That you have to understand. It is not all marijuana, not all cannabis. It is a chemically engineered substance. and that is also we are not sure about. That is also an experiment. But problem is marijuana is freely available. Though it is illegal, but it is freely available. Otherwise, this 16-year-old, 17-year-old small kids wouldn't be having that marijuana in their hand. Where they are buying from? We need to do something. We need to spread the awareness. We need to do something at least to save them from misleading. They are getting misled. Please support my video. Please spread the awareness. Please talk to everyone that you know about this and stop this misleading comments of medical marijuana. There is nothing medical in it. It is a poison. That is a poison. A person who is taking that poison knowingly is fine, a mature person. But please stop it with the kids. They are the future. They do not know what they are doing. They are really thinking medical means really something having medicinal effects. But it is not. It is not the case. It's very serious, very grave, and very important thing that we decide now. We want our country to prosper with a strong young generation, not addicts. Please. Thank you. Share my video, like my video, and please subscribe to my channel. I will be coming back with more information. Thanking you for the support.